Welcome everybody to Pharmacy and the Healthcare System. This lecture is focused on home care. This chapter is from the McCarthy textbook, so please consult it. As with every lecture, we begin by perspective. So here's the big picture of our entire healthcare system. And with home health, we do know that it is within one of the entities of providers. Our learning objectives, we will describe and explain what home care is, various types of home care industries. We will describe the different kinds of therapies that are available to be administered at home. For example, there's home infusion therapy administered by, for example, nurses. But remember, there are other types of therapies that can occur within the home. Physical therapy, occupational therapy, for example. We will talk about some of the major factors that influence the home care industry, rules and regulations, some barriers to entry, for example, reimbursement. Reimbursement in this area has been at least not the highest, and in fact, most argue that it's fairly low, and that has been one reason why not too many people have been getting into it. However, with the aging population, there's quite a bit of opportunity, along with policies such as the Affordable Care Act. And then finally, we'll end with the role of pharmacists in providing home health care. And home care, going back to that first point here, just to define home care, is to restore or maintain the patient's optimal level of well-being in a familiar environment. Why should we do this? Why do we do this? Because it's cost effective, can be cost effective. Sometimes it's patient preferred. People would rather get better or rehabilitate at home rather than in an institution such as a hospital. And sometimes it also could be efficient. For example, if there's long-term IV use, instead of going to the institution, like a hospital, it can be done at home. So without having the patient to travel, for example. This is the long-term care continuum. You should be familiar with this, as we talked about it when we talked about long-term care, and specifically we talked about the various kinds of long-term care. And here's the spectrum from self-care, so relatively healthy, if not completely healthy. And then as you move downward, kind of the loss of functioning or loss of quality of life, and the need for more services, and in particular skilled nursing services, and as far as all the way hospice care for the terminally ill. So this is our focus is on home care, nursing care. This is just showing the projected spending within all these healthcare entities or within the healthcare system as a function of time versus dollar amount. So as you can see on the left, those are basically in billions of dollars. And from the top, from the legend there, we can see that hospital care and physician services are the top two in terms of greatest percentage. And if you look real closely at the slope in terms of the projection, and even before the projections start, prior to 2010, that the rate of increase is even highest with these two, hospital care and physician/clinical services, followed by prescription drugs, so medication use, then research structures and equipment. So this is the area of, for example, not only clinical research, but for example, medical devices. public health activity, of course, near and dear to my heart is that one of the green, colored in green there. And you can see all the other ones that kind of follow: net cost of private insurance, government administration, other medical products, and then nursing care, other health and residential personal care, so things like over-the-counter medication, supplements that would fall under this service or care, dental services, other professional care, and you can see at the very bottom is home health care. And as I mentioned earlier when we were talking about the objectives, this is quite a barrier for those companies and providers who want to get into home health care. That so far has been the smallest piece of the pie. However, the projections for the greater percentage of the population being the baby boomers at greater than 30% from 10 or 20 years from now will serve as a niche market and target segment for many companies who will focus on home healthcare provisions. So if we blow up and look at home healthcare by itself, we do see this nice steep increase of the rates, so that there is again growth and opportunity within this field. So what are the patient factors in terms of home care? Well, sometimes a person is sick, they're too sick, but they might be healthy enough to avoid the hospital setting, the institutional setting. So what does this mean? Well, this means that they might have a condition, a medical condition, a disease, a disorder that's treatable with some technologies in the home, whether that's pharmaceutical technology or medical device provided by a pharmacist or some sort of physical or occupational therapist, respectively. So many types of ambulatory services can be provided at the home. And typically, home health care means that it's not just an acute condition, but there might be some more of a chronic condition that is going to be treated. And one of the factors when thinking about home care is there a home to go home to, first of all, but is there also help? Is there going to be assistance from another caregiver, such as a child or a spouse? Okay. Answering the question, are the patient's living environment needs being met? So, meaning, is it appropriate overall in the context of the entire environment of the house to appropriately deliver the treatment that you're trying to administer? And of course, is it available in your region, in the geography? And possibly related to that is, we've already alluded to, is it reimbursable? So meaning, is there financing available? And short answer is yes. Some coverage through Medicare and Medicaid, and then less financing through private insurers. However, again, with healthcare reform, things are changing, even in the home care industry, where it could be more cost effective to treat a person in a home care setting, then provisions will dramatically improve in terms of rules and regulations and services in the context of home care. Here are certain groups and organizations that will help to assess the state of home care services, help to advocate for, help to develop best practices and guidelines. So that includes Visiting Nurses Association, home health agencies, and even the government, right? Veterans Affairs and Veterans Administration. They want to make sure that they take care of their geriatric population in a cost-effective manner. So what are some of the types of home care services? Well, in general, they could be nursing, rehabilitation, and therapy. Obviously, therapy is very broad, but here we're talking about general nursing care, perhaps wound care. Somebody has a wound that might not heal very quickly, but they don't necessarily need to go to the hospital or clinic on a regular basis to be treated, but instead can be treated at home. That's where home care is going to be cost effective, is treating, for example, something like a wound. Other things that might be cost effective to treat at home include speech, physical, and occupational therapy, and then hospice services that we've talked about. Sometimes when a terminally ill patient is at that stage, from a cultural perspective, not just from a cost effectiveness analysis standpoint, but from a cultural and social standpoint, it is maybe very beneficial, most beneficial to a family when they are receiving this type of therapy or services within the context of the home. Sometimes there will be a social worker who will manage all these home care services for proper and efficient coordination. If we want to make it cost effective, we need to have proper coordination. Another particular service that might not be considered medical or pharmaceutical, and sometimes we generally categorize this section as homemaker services, is the service of delivering proper nutrition. And so one of the companies, a nonprofit company called Meals on Wheels, when contracted by a provider and paid for by hopefully a insurer, or perhaps a private insurer, and perhaps out of pocket, providing proper nutrition to a particular patient who might not be able to cook and make nutritional food, well, we can bring it to their home. And I mentioned, are there other programs? In the last lecture, we talked about some of the healthcare innovations that the government is willing to fund. So knowing that although there's a lot of barriers to home healthcare, and that the pie or the percentage of spending in this area is relatively low, but knowing that there is going to be a progressive need for these types of services, other programs that you can think of in a public health standpoint to think about, for example, primary prevention to deal with and effectively have proper high access to care at low cost. So thinking about quality here. So other home care services that was mentioned in the particularly in the learning objectives include what are some of the infusion therapies. Again, just kind of noted in the last slide related to nutrition, but perhaps it has to be administered through a catheter, for example, with parenteral and enteral nutrition to deliver not only macronutrients such as carbs, proteins, and lipids, but how about the micronutrients, vitamins, and other minerals? Antibiotic, so anti-infective therapy to obviously to deal with bacterial infections or even viral infections. And in this case, treating a condition like osteomyelitis is another provision of healthcare services. Infusion therapy. Someone who has chronic pain could be treated at home with proper opiate medications. those who might have neoplastic disease, cancers. We could deliver chemotherapy such as 5-fluorouracil. This is an area of home care services that's, as you can imagine, growing just because of our geriatric population. Durable medical equipment, infusion pumps, wheelchairs, anything that might help a patient ambulate, have proper musculoskeletal support, braces. And this is a whole area within a category in and of itself that is fairly regulated, durable medical equipment, whether it's making the product itself or even selling it as a pharmacist, require some regulations, some protocol, some provisions of the pharmacist. You can't just start ordering wheelchairs, canes, and walkers to your pharmacy. There are proper rules and regulations for you as pharmacists to sell durable medical equipment. Is it highly profitable? Yes. And that's why you'll see many pharmacists will sell durable medical equipment for home use. Other medical equipment would be things related to respiratory therapy, so the sale of oxygen tanks, breathing apparatus, and other things like blood glucose monitor, heart rate monitors, blood pressure monitoring. Could also be other home care services that are that could be sold as medical equipment. This is just a good break for us to take, and I just wanted to show you a poster that was developed by former students who I mentored in their pharmacy management course a number of years ago. And you will do the same in pharmacy management, where you will have to develop a product or a service, write up a business plan, and present and pitch it. So in this case, students were interested in monitoring, in particular the use of mobile devices in monitoring and detecting various disease states, including infections, sudden infant death syndrome, and other disorders as well. And it was going to be some kind of wearable device and obviously an app for the smartphone. And this would improve home care for infants, for example, by providing the tools necessary to monitor certain vital signs. What are some home health care issues or factors that have moved along home health care? We can talk about legislation. There's obviously insurance variability, and hopefully it's improving, meaning that one, there could be greater reimbursements. And then from a regulatory standpoint, and standards of care or standards of practices, that there's obviously involvement from the state as well at the federal level. So two important legislative acts that help with home health care and its definition as well as reimbursement include Balanced Budget Act as well as HIPAA. Again, you can see how important HIPAA is. HIPAA has a lot of provisions related to many aspects of the healthcare system and provisions of products and services. But quickly, with the Balanced Budget Act, know that it did help also reduce Medicare fraud. Within the context of the Balanced Budget Act, it helped to implement and increase prospective payment systems versus or contrast that to retrospective payment system. Prospective payments is kind of the idea of, again, capitation, where an insurer will pay a set fee for these services or services given to a patient, for example. And then with HIPAA, there was quite a bit of reform and some administrative simplification that improves the home healthcare reimbursement. With respect to insurance variance, we know that it's quite a bit of variation, and not only variation, but when you compare cost of hospitalization with home healthcare is quite favorable. That is cost effective, especially when you're comparing apple to apple, meaning same treatment, but just in different contexts. And then this is obviously true where managed care and, for example, health managed organizations, although they might have favorable rates, favorable enough, but at the same time, there's issue with profitability for providers. So sometimes it's providers may not want to get into home health care for the fact that it's not profitable. And with respect to rules and regulations and certain mandates related to home health care, you always have to talk about state and federal regulations. Departments of Health at the state level, Centers for Medicare and Medicaid, Drug Enforcement Agency, and the Food Drug Administration, just to name a few agencies that might impact home health care. Accreditation. You're not going to get paid by Medicare unless you are providing the best standards of practice. Whether it's non-state or non-federal agencies, these are some of the players in terms of agencies and organizations that do accreditation. The Joint Commission that we mentioned in the hospital lecture, and others including the Accreditation Commission for Health Care, and then also Community Health and Preventive Services Organization. And obviously, again, you need accreditation for reimbursement, especially for Medicare, Medicaid reimbursement in this area. Telehealth has been increasing to provide greater access, especially in areas that have low access, for example, in rural areas. And related to telehealth, as pharmacists, you have to talk about telepharmacy and telepharmacy provisions as well. So what is your role as pharmacist in home health care? Obviously, you are a member of the interprofessional team through either a community pharmacy, home care company, or hospital outpatient pharmacy. And you might be part of the selection process or selection of a patient for proper administration of home health care. And you're asking yourself, is that treatment available? Is it reasonable therapy? You might also ask about things such as insurance and reimbursement. Or are there other financing options for the patient? And you will also have to consider social, environmental, and support for that patient. Again, do they live by themselves or do they have family members to help as caregivers? Other things, probably a very important aspect when it comes to proper medication therapy management, as well as executing a care plan, obviously selecting the proper therapy. You might initiate care, so you might help with the administration of the first dose, but you might also follow up. Devices, are there durable medical equipment that's utilized and can be given to this patient? Other supplies has to be considered. Particularly pharmaceutical services such as compounding and other dispensing services that addresses you as the medication expert have to address issues such as drug stability and sterility, making sure that the patient is storing the medication properly, the packaging of the medications. If it's home infusion and nutritional related therapy, are the medications and are the nutrients properly stored and refrigerated, for example. And of course, you're keeping a track record of this, so you will have proper scheduling and as well as monitoring. And because you are providing medication therapy management, you are counseling, you are providing patient education. The American Society of Health System Pharmacists provide standards in home care pharmacy. So things like when you are helping with the patient selection, what is your assessment? So pre-admission assessment. So similar to a person who is going to go into long-term care and assessing for ADLs and IDLs, that MDA form. So is there a form, is a standardized form to keep patient database and assessment? You have monitoring for proper selection of products and devices. And these all could be electronic, right? At this point, especially in our current times, the use of electronic health records is very important in terms of abiding by Affordable Care Act rules and regulations. I'm not going to read you all of them. You can read for yourself the plethora of other standards, but notice how some of them you are currently already doing or learning in pharmacy school. Other things you have to learn kind of outside the realm of pharmacy because in particular, it only pertains to home care services. This comes from this report from the American Society of Health System Pharmacists. And I have provided a link at the bottom there so that you can get it yourself. For those of you who are doing a project in this area, it is a good idea for you to reference this document. And at this point, this concludes this lecture, and hope to see you soon.